For those that don't know me, my name is Nia. You can find me on Instagram and Twitter at _Queen Nia with 2 A's. I'm a semi-recent UCLA alumni, and I am currently working as a pediatric intensive care nurse. For those that are not new, I know it's been a while and I apologize for that. To be quite honest, I've been a little distracted by other things, but I'm trying to get back on track to post more content for everyone. So as you guys can see by the title of this video, today we're going to be talking about my experience of being a PICU nurse for 1 year. I thought it would be the perfect time to reflect on my experience since I get a lot of questions on social media about nursing, and also this is a time of year where newer nurses are starting their new grad program, so I just wanted to give some advice to them and to anyone that's also just even considering going into nursing. So before we get into it, go ahead and subscribe and turn on my notification bell if you haven't already, and if you like this video, don't forget to give it a thumbs up and leave a comment at the end. So the first thing I'm going to talk about is what is an RN residency. Sometimes people refer to it as a new grad program, whichever you prefer, it's up to you, but it's all the same thing. I wanted just to give a little bit of background for those that are not familiar. So essentially a residency program is a training program for newer nurses that have less than 6 months of experience of being an RN. The time period of a residency program kind of varies from hospital to hospital. I've seen anywhere between 3 months and 1 year. My program personally was 6 months. Residency programs typically begin with a combo of classes and also preceptorship. Preceptorship is pretty much just working with an experienced nurse who's there to guide you as you enter this new role and to help you get acclimated with the whole policy and procedures of your hospital and how to even be a nurse in that specialty. I think that's like the easiest way for me to explain what an RN residency program is. I know it varies from hospital to hospital, but that's kind of a little summary for anyone that's not familiar. The next thing I want to talk about is what I wish I knew before starting my residency program. The very first thing I wish I would have known is that this whole year was going to be a very insecure year for me. You know, I think we go through nursing school, and nursing school is hard, so you think that you're going to get a lot from it. It's going to teach you how to be a nurse, but it only really gives you general knowledge about a bunch of shit. Like, I can't put it in any other way, but nursing school is like such a broad range of knowledge that you can only really apply like the fundamental skills that you learn to your actual day-to-day practice. You learn a lot more during your actual residency program when you first start as a nurse than you learn in nursing school, and that's just how it goes. There's no way that any nursing school can teach you everything you need to know for every single specialty that you might go into after you graduate. So it was so insecure because I felt like I knew nothing all over again, and that's kind of what you go through for your first couple rotations in nursing school. I think we all can remember like our very first clinical experience, and we're like outside the patient's room and we're just like, do I just go in? Should I knock? Like, what do I say? It's like you have a little stutter when you be like, I'm gonna be the nursing student today. And it's just like, you go through that same stutter when you start as an RN resident. You change your whole introduction from, hi, I'm gonna be the nursing student, to hi, I'm gonna be your nurse today. And it honestly, it feels strange. You feel like a sense of insecurity, you lack confidence, and I don't think I was necessarily ready for that. I kind of felt like I was starting all over again. And I think just having in general a heads up of the emotional experience I was gonna have as a new nurse would have kind of prepared me more. And I just want you guys to know that it is normal and it's okay to feel insecure, and it gets better with time. I think the second thing I wish I would have known before starting residency was that I was going to have to pretty much give up control of my life all over again. Your schedule literally depends on the lives of your preceptors and also these scheduled mandatory classes that you have to go to. So your personal life is pretty much non-existent. Everywhere I think makes exceptions for like life emergencies and all that. But anything personal, anything fun, anything you just wanted to do, yeah, that has to be on hold, or it just has to fit around your schedule. So during this residency time frame, I wouldn't plan anything big. I mean, there'll definitely be weekends where you have off and you can make little plans, but as for trying to go anywhere or trying to make sure you have certain weekends off, like, that's not gonna happen. I mean, it makes complete sense, but it still sucks, you know. But you just have to honestly be grateful that somebody is willing to precept and teach you, and just remember that the sacrifice is temporary and it's something that you'll be grateful for in the end. The third thing I wish I would have known before starting is that fear is completely normal. When I first started working, it was scary, and to be 100% real with you guys, I felt ashamed of it. I felt like, damn, did I choose the wrong career? Did I choose the wrong unit? Am I not made for this? But with time, I realized that I should be scared. This is someone's life that you're dealing with. You're playing a role in saving someone's life. And that's not just a everyday experience that people have. The general population doesn't have that experience. So if you're not scared at all, if you have no sense of fear or anything, when you first start your job, you should be a little bit more worried, because there's no way that you know exactly how to be a nurse. And I really just want every new nurse to know that fear is normal, and it really just proves that you want to be safe and you want to be a good nurse. Even though it might not feel like it, I really think that's what the fear is rooted behind. You just have to get comfortable being a nurse, and all these things I talked about really get better with time. But you know, it takes practice, it takes experience for you to get there. The next thing I'm going to talk about is my biggest challenges. When I first started my YouTube channel, I did like a Q&A on my story, and one of the questions was, what was the hardest part about starting my career in the ICU? I think in general, starting your career as a nurse is hard, but I think the ICU has its own challenges and is a little bit more difficult than other units. I think that's because you're dealing with the sickest patient population, and you have to be on your toes at all times. Along with trying to develop your typical skills like medication administration, communicating with providers and other disciplines, physical assessment, and even just knowing what's going on with your patient from a physiological standpoint, you also have to have situational awareness and pay attention to all details. This means that you can be, you know, spiking a med and your patient's blood pressure is dropping. So you have to understand what's going on. You have to be able to do this and watch the monitor, pay attention, and don't get too caught up with the task because your patient's more critically ill and unstable. So I think that's what makes the ICU more difficult than starting on other units. I'm gonna talk about my general challenges as being a new nurse. I'm sure that these challenges apply to ICU nurses, floor nurses, transitional care nurses, OR nurses, whatever type of nursing you end up going into. I think that these challenges are definitely across all specialties. My first biggest challenge was time management. Trying to do everything effectively and on time was probably the hardest part when I first started. I remember when I first started, and I would get a report and people would use like these abbreviations and talk about these procedures that patients had, and I was sitting there like, I have no idea what you're talking about. But you also don't want to be that person that asks like a million questions during a report, because the nurse that's giving you a report wants to go home too. So I remember I would just like jot everything down, only ask like necessary questions. So this took away time during my morning because I was inexperienced and I had to look things up. But with this, spending like the first 15 minutes of my shift trying to just really understand what's going on with the patient, at least in a general sense, it would always push me a little bit behind. So I always felt like I was kind of playing catch up. Then I'm like a bit more experienced, I don't have to look up as much. I mean, there's always going to be things that you come onto a shift and you're like, I've never actually seen that. There's so much to learn, even when you get 5 years, 10 years, whatever into your practice, that there'll never be a time where you feel like you know everything. But it does get better. You start to know like the more common things, you start to see things over again, and you have a better general understanding. Another challenge when I first started was charting. There is a lot of charting, especially working in the ICU. We chart on things every single hour. So when I first started, I was like, always felt like I was behind. Like you'd be trying to get your morning started and they start rounding and they're like, oh, what's the I's and O's? And you're like, I haven't even had time to sit down and chart. I think with time you get a little faster with doing everything, getting your charting up to date, and you realize like, what are the important things to chart on? You'll learn that I should chart on my I's and O's, and I can chart on my PIVs and central lines later, you know? I think also what makes charting difficult in the ICU is that a lot of things you have to reassess frequently. I mean, I can give you guys one example. Is like we do Q1 hour neuro checks a lot, and I swear when I first started I was like, it's always a new hour, it's always time for a neuro check. But I think you just get faster and better with your assessments, better focused assessments as time progresses. So I think another challenge with time management is like when I was done with precepting and I was just a newer nurse on the unit, they typically give you the stable pairs. And with these pairs, you know, you're usually still charting every hour. A lot of the times the kids are total cares and they have a lot of meds, and it's hard. I felt like there were definitely shifts where I felt like I was running around with my head cut off trying to get everything done, and it was like you're busting your ass the whole time. And I think the struggle of time management gets better with time. It's just you get better and better as you practice, and a lot of things become second nature. But when you start, just know it's okay to feel like you're playing catch up the whole time, and don't think it makes you a bad nurse, because we all have to start somewhere. My next biggest challenge working in the pediatric ICU were parents. Working in the pediatric world, you really realize that you never have just your patients. You have your patients and their family members. I think for most parents, just hearing that their child needs ICU care is anxiety provoking, and just to add to their anxiety level, they find out they have a newer nurse or a new grad that's precepting and learning essentially on their child. So it's expected for some of them to be nervous, and sometimes it results on them taking out their frustration and their fear on you, and you get treated a little poorly, and it could be really discouraging. To a parent's defense, this is their child and they're scared. It doesn't mean that it's right for them to talk to you poorly, but it is understandable why they have some doubts in your abilities. With that, I think you just need to learn to take it in and develop a sense of empathy for what they're going through, for what they're experiencing. I think once you develop this empathy, you are a lot more understanding, and it doesn't bother you so much that they doubt things that you are capable of doing. You just kind of have to take some of these shots to your pride and understand it's really probably not about you. And no, this also gets better with time and experience. I think parents feel a lot more comfortable when they see that you're not training anymore on their child. I think there are still times, like just looking young in general, or if they ask you like, oh, how long have you been a nurse, it can make them a little uncomfortable. I think you just, you know, you do your job to the best of your abilities. You make sure you're keeping your patients safe. You make sure you understand what's going on with their child, and you involve the parents. And I think it just develops a bigger sense of comfort for them. That's all you really can do, because it's always going to happen. Even if you have 3-5 years of experience, there's always going to be parents that still feel a little bit on edge, that might not treat you the best. I think my third biggest challenge was just the work environment. Working in the ICU is like working with a bunch of type A individuals. One that works, I think, in the ICU in a sense is kind of particular in the things they want, and it's a bit controlling. It's a way to keep things in order and to keep things organized in an environment that could be very unstable. I think just working in the ICU, you kind of have to have tough skin, because people can't necessarily baby you. They have to tell you what it is. At times things can come off wrong, and sometimes it's not the intention, and sometimes people do still kind of eat their young, and that's like a general nursing culture that needs to change. But it's still hard, you know, being new and wanting everyone to like you. In general, those are my 3 biggest challenges. There were definitely more, but I think time management, learning how to deal with parents, and adapting to my work environment were the biggest challenges that I encountered. There's always going to be other things that are hard. Don't get me wrong, there were a lot of things that were hard when I first started, but it does get better. So I just hope by like sharing my own challenges, you know that your challenges are okay too. To bring this video all together, what I learned in the end was that there is always more to learn. And it was a very humbling experience. No matter how much school you go through, and no matter how hard nursing school was, things are always changing in the nursing world. No matter how many years of experience you have working as a nurse, things are always going to be changing in the nursing world, and you're always going to be learning, and that's okay. If I had to give any advice to newer nurses, it would be to ask questions, even when you feel like you should know the answer. It's always better to ask questions and be safe than to potentially hurt your patient or do things the wrong way. I know that sometimes it can be discouraging to ask questions because how some people might respond, and you know, if people make you feel bad about asking questions, then that's on them. They were once new too. I'm sure they once had a lot of questions, and I just don't think you should take it too much to heart. I do think though, like in regards to asking questions, you should put some effort in. Like, you know, if you can look up a policy and procedure and read it through, and you have a question about a particular thing, then it's easier to approach somebody with like a single question than being like, hey, can you show me how to do a whole central line dressing change. It's always a little better to prepare yourself, and also it's like helps you in general to be self-sufficient. Next piece of advice would be to find your people. No matter how close you are to your friends, your family, or even your significant other, if they don't work in the nursing field, they'll never completely understand what you're going through, and that's okay. But I think it's important to find people that you work with or people that are also nurses that you can go to for an outlet to vent. I think it's important that you don't keep things in. Holding on to all the emotions and all the feelings you have and never really talking about them contributes to burnout, so find your people. And I think I would also tell newer nurses, it's okay that everyone at work might not like you. I think when you first start, you're like super fixated on like trying to make sure everyone likes you, everyone thinks you're doing a good job, but there's always going to be someone that is not too fond of you, and that's every work environment. I think that's every field, no matter what. So don't get too caught up with making sure that everyone likes you as a person. Focus on making sure that you're being a good nurse, that you're doing the right thing for your patient, and you'll find your friends along the way. My next piece of advice would be to not let nursing become your entire life. I think by understanding that nursing is just a part of your life, it kind of keeps you sane. You don't want to get too consumed with this. Even though you can love nursing, it can definitely be a part of who you are. It's not all of who you are. You can have a life outside of being a nurse. You don't have to feel like you're a nurse 24/7. And I think it's important to have a piece of yourself that is just for you, and you don't have to share with everyone else, because nursing is a very giving career, and you go to work and you give all of yourself to your patients, to their families, to this job. And I think it's important to have a balance in life, just in general, to help you not get burnt out, to help you have a sense of self outside of the nursing world. My last piece of advice would be to keep going. It does get easier, I promise you. It might not feel like it right now if you're new, but it does get better. And keep learning and keep going, and don't be too discouraged. I mean, if you went through nursing school and you went through all that, I'm sure this is the field for you, and you'll find your way. We all find our way. If you guys like this video, don't forget to like it, hit the thumbs up button down there, and subscribe and turn on my notification bell. I hope you guys enjoyed. So until next time, I will see you guys later.